South African scientists today warned that the new Botswana Covid variant may be driving a rise in cases in the country as the World Health Organization said it was convening an emergency meeting tomorrow to investigate the troubling strain. The national infection rate in South Africa has surged more than fivefold in the past week after the variant was first detected in neighboring Botswana on November 11. Around 100 cases of B.1.1.529, its scientific name, have been officially detected so far. But it's been spotted in nearly every province of South Africa, health chiefs there said today, and is already in 3 countries, including Hong Kong. Alarm about the variant was first sounded yesterday after it was revealed it has 32 mutations and is the most evolved version of COVID yet. Concerned health chiefs in South Africa revealed in a hastily organized press conference today that the variant may be outcompeting the dominant Indian Delta strain because it can infect vaccinated people more easily. Professor Tulio de Oliveira, a director of COVID surveillance in the South African province of KwaZulu-Natal, admitted experts were still uncertain about the impact of the variant on the country's epidemic. But he explained the virus has 5 times more mutations on a specific part of the spike that antibodies bind to compared to Delta. Current jabs train the immune system to recognize an older version of the spike, and lots of changes to this protein make it harder for the vaccinated people to recognize the virus and fight it off. In a glimmer of hope, British experts told Mail Online yesterday that the extensive mutations might work against the virus, making it unstable. They said it likely emerged in a lingering infection in an immunocompromised patient, possibly someone with undiagnosed AIDS. Professor Oliveira said he had asked for an urgent meeting with the World Health Organization, WHO, to address the rising variant, which could be named new in the coming days. Some 26 cases of the variant have now been detected globally, with a majority in South Africa. But a lack of testing analysis on continental Africa may be masking the true spread of the variant. Advertisement. The first case was identified in Botswana on November 11, and it was picked up in South Africa the following day. A case was also spotted in Hong Kong on November 13 in a 36-year-old man who had traveled back from South Africa on November 11. In South Africa it has been officially spotted in the Gauteng, Limpopo and Northwest provinces. But Professor Oliveira warned it could already be in nearly every province. Dr. Tom Peacock, a virologist at Imperial College London, who first sounded the alarm about its spread, described the variant's combination of mutations as horrific. that B.1.1.529 had the potential to be worse than nearly anything else about. Professor David Livermore, a microbiologist at the University of East Anglia, told Mail Online the Botswana variant concerned him because of its very extensive set of mutations. He said, "This increases the risk of vaccine escape, but doesn't prove that it will occur." Nor is the strain's infectiousness clear, and it too will be affected by the spike's structure. The Botswana variant carries mutations K417N and D484A that are similar to those on the South African Beta variant that made it better able to dodge vaccines. But it also has the N440K, found on Delta, and S477N, on the New York variant, which are also linked to antibody escape. The variant also has mutations P681H and N679K, which are rarely seen together and could make it yet more jab-resistant. And the mutation N501Y that makes viruses more transmissible and was previously seen on the Kent Alpha variant and Beta among others. Other mutations it has include G446S, D478K, Q493K, G496S, Q498R and Y505H, although their significance is not yet clear. Dr. Marichand, from the UKSA, said, "The UK Health Security Agency, in partnership with scientific bodies across the globe, is constantly monitoring the status of SARS-CoV-2 variants as they emerge and develop worldwide." As it is in the nature of viruses to mutate often and at random, it is not unusual for small numbers of cases to arise featuring new sets of mutations. Any variants showing evidence of spread are rapidly assessed. It comes as COVID cases continue to rise across the UK, but deaths and hospitalizations still firmly trended downwards. Another 43,676 cases have been recorded in the last 24 hours, a rise of 14.1% on the 38,263 confirmed positive cases last Wednesday.